what's in the U.S. stockpile. The concern right now among scientists is, why is this spreading? Why is this suddenly emerging? Is it just founder's effect? Did it get into communities where it started to spread more efficiently, and that's sort of the scope of the outbreak? Or is this just the tip of the iceberg, and this has been spreading in the community more widely, which I think it may have been, and we just identified?
With receding COVID-19 numbers in several parts of the world, the threat to your health is over, then here's something you need to pay attention to. It's now monkeypox that is troubling the European nations, along with the United States and Australia. And with that, the viral infection has raised an alarm all across the globe.
Tolerated the COVID-19 epidemic, but there is a possibility that now that this has gotten into the community, if in fact it's more pervasive than what we're measuring right now, that it becomes hard to snuff out, because a lot of these cases are mildly symptomatic. Patients might not present. They're going to get misdiagnosed because doctors aren't used to evaluating this virus. And so if it is persistent, I think that can still cause a lot of disruption, first of all.
But when it is transmitted that way, it's usually through close contact. So that's typically through large droplets, so think saliva, or through direct contact, so from pus from the lesions on.
As the world was surviving from novel coronavirus and starting to live a normal life, a new virus was spreading in North America and Europe. A virus that is involved in the deaths of 6,000 people in a dozen African countries every year. According to Wikipedia, it is caused by the monkeypox virus, which is a double-stranded DNA zoonotic virus. Its symptoms include fever, headache, muscle pains, tiredness. Human-to-human transmission most commonly occurs through respiratory droplets, though usually requires prolonged face-to-face contact. Animal-to-human transmission, meanwhile, may occur via bite or scratch. As the endemic quickly advanced across Europe and North America over the last week, and is expected to be far more widespread as more doctors and health workers check for symptoms. The US and Australia this week also confirmed their first cases. Germany on Friday reported its first case of the virus, becoming the latest European country to identify an outbreak, alongside the UK, Spain, Portugal, France, Italy, and Sweden. Belgium introduced a mandatory 21 days quarantine for monkeypox virus infected civilians. According to the Center for Disease Control, monkeypox can kill as many as 1 in 10 people who contracts the disease, but it is not as severe as smallpox. One of the history's deadliest disease, smallpox is estimated to have killed more than 300 million people since 1990 alone. But a massive global vaccination campaign discontinued the disease in 1977, making it the first disease ever eradicated. With the remaining stocks of variola virus, research continued in 4 locations in the world. Those were in United States, England, Russia, and South Africa. In 1984, England and South Africa had either destroyed their stocks or transferred them to other approved labs. Those are now only in 2 locations that officially store and handle variola virus under WHO supervision: the Center of Disease Control and Prevention, Atlanta, Georgia, and the State Research Center of Virology and Biotechnology in Kosovo, Russia. The World Health Organization says the virus spreads through close contact, so it can transmit to the health workers and sexual partners who might come in contact with the infected one. as the WHO claims that the virus isn't a matter of concern, so it may not have an adverse effect on the growth of economy. But in case, if this gets worsened, then the crowded places of public gatherings like restaurants, malls, festivals would be restricted. Just like happened during COVID-19. Especially, music festivals like in DJ concerts would be the hotspot for the widespread of this virus, where people squeeze together skin to skin. One infected one can infect thousands. So people will stop visiting these places and business would go down. People worked indoors would get a blow of unemployment. Nevertheless, the vaccine used to prevent smallpox appears to be about 85% effective in guarding against monkeypox in observation research in Africa, WHO officials said. So the disease can be damped before it's widespread. Prevention is the best way to dominate over this virus. Raising awareness of risk factors and educating people about the measures they can take to reduce exposure to the virus is the best strategy. As the health workers are more vulnerable, testing of samples should be done by trained staffs in well-equipped laboratories. Avoid contact with animals that could harbor the virus, including animals that are sick or that have been found dead in areas where monkeypox occurred. By surveillance team, rapidly identifying cases and the sources of infection as soon as possible in order to provide optimal clinical care, isolating suspects to prevent further transmission, managing contacts and tailoring effective control and prevention methods based on most commonly identified routes of transmission is the only way for them to control widespread. As people consume nutritious food, it will boost immunity and safeguard health. Cleansed fruits and vegetables will ensure no trace of the virus. With newer vaccines, diagnostics, and antiviral agents are being developed, this can control monkeypox to a large extent.